This is just a schematic of the areas that we can treat, and so on, with HIFU and with NanoKnife. And you'll see, I've just mentioned it here on the left-hand side. You can see the primary, or what we call the index lesion, in red in different parts of the prostate. But there are little yellow areas as well. What do those little yellow areas mean? Those little yellow areas indicate very low-grade, low-risk disease. And it's now accepted throughout focal therapy circles that you can safely monitor and observe low-grade, low-risk disease elsewhere in the prostate and treat what is known as the index lesion. And there's very good evidence for that little low-grade tumor will not cause you any harm at all. And the argument that I always use is that if those red lesions weren't there and those little yellow lesions were there, we wouldn't treat you at all. And because we wouldn't treat you at all, then why are we worried about treating it when we're treating the index lesion? So that's a sort of nuance of focal therapy, whereby low-grade, low-risk disease can be safely observed as long as the index lesion has been treated. The other beauty about focal therapy is that if that low-grade, low-risk disease was to change in any way or get bigger, you could ablate that as well. Cryotherapy, again, a well-established treatment, but only really suitable for certain parts of the prostate. Cryotherapy, and I do all three, so I do NanoKnife, cryotherapy, and HIFU, is probably the most aggressive of the three. So we utilize cryotherapy in areas of the prostate which are unlikely to cause any harm to nearby nerves or other structures. So we tend to use cryotherapy for the front of the prostate rather than the back of the prostate. But again, very good data in carefully selected patients, who can have cryotherapy. And again, treated the same way as a daycase procedure. This just goes to show that we can actually increase or decrease the size of the ice ball depending on how big your tumor actually is. What about NanoKnife? So this is the latest kid on the block, if you like. So in the focal therapy clinic, we've been utilizing it since late 2022 and early 2023. We took it on relatively early in the UK. Nice guidance came out in July 2023. And that's basically because we were impressed with the results from Australia. Phil Stricker, who we know pretty well, in Sydney, has produced very good 5-year data utilizing NanoKnife. So what is NanoKnife? It's another focal therapeutic technology, and it uses electrical pulses of short duration and a high voltage to create holes in the cells, including the tumor cells. So, and these holes are nano size, so 10 to the -9, hence the word NanoKnife. There is no knife involved at all. Okay, these are holes that are created through electricity inside the cell membrane, and then the cell contents, disperse and they die. And that's what triggers the cell breakdown and death. We know that it preserves surrounding structures. We know that nerves and blood vessels can be preserved. So again, a very good technique. Just move on. This is just a schematic. It's non-thermal, although there is some thermal effect of this. It preserves local structures, no bowel or bladder problems afterwards. And this is just a very quick schematic that there are 5-year outcomes that have been published, from Australia. Side effect profiles of the three. There's been no trial that has looked at all of these three together. We tend to base our decision on which treatment is best for an individual patient on the geographical location, the grade and so on of the prostate cancer. We know that all of these are very good in terms of preserving function, both in terms of potency and in terms of serious complications. You will see the figure on the extreme right is for radical surgery. So this is comparing NanoKnife, HIFU, and radical surgery. What about randomized control trials, which is a holy grail of any study? There have been none to date. The closest that we have got now is what's called the FARP trial, which is focal ablation versus radical prostatectomy. And it's a Norwegian study of about 200 patients. It has already reported, but the final publication is not yet out. And you can see that their endpoint was if a patient needed an additional treatment afterwards. So 9 of the 100 odd so patients in the radical prostatectomy group needed radiotherapy afterwards, and 7 of the focal therapy group needed radical treatment. This is only over 3 years, but again, very helpful because it's the only randomized controlled study. There is a study going on in the United Kingdom at the moment called the PART trial, which stands for partial ablation versus radical treatment, and that is still recruiting in many centers. So, but we await that result, in a few years' time. So future perspectives, we know AI is going to play a major role in our treatment pathway, in our diagnostic pathway, and in developing tests and so on, which can be read very, very quickly. Robotic biopsy is also coming in. There's something called BioBot, which will allow us to target better. Incorporation of PSA, multiparametric MRI, PSMA PET CT scans, which are difficult to come by, particularly on the NHS these days, because they are very expensive. We suspect that all these imaging modalities will be incorporated into the diagnostic paradigm. Personalized medicine, I've alluded to that. We assess each patient's prostate cancer very carefully as to what treatment is going to be suitable for them. And of course, we always focus on quality of life and survivorship. And that's because the PROTECT trial, which was the only trial which has been heavily criticized because it's an old trial and so on, but that showed no difference between surveillance, radical surgery, and radiotherapy at 10 years. So therefore, the choice of what patients choose will depend on their idea of quality of life and the side effects that they may or may not wish to suffer from. So this is just a schematic of the BioBot, just showing that we can be even more accurate in terms of determining our biopsy protocol. And NanoKnife received an award, one of the best inventions, according to Time magazine of 2025, which is a nice accolade to have.